Hello, I'm Llewellyn King for CFS Alert. Mold is a large issue in this disease. People who suffer from myalgic encephalomyelitis are often very sensitive to mold. I have letters, I have correspondence from people telling me about how they've had to move out of buildings, sometimes live in trailers, particularly trailers that have been built for them. So it is with great pleasure that I'm now talking on Martha's Vineyard in Massachusetts, or off the coast of Massachusetts, with Lavine Nagy, and that's spelled Nagy, who is an expert, one of the nation's leading experts on environmental medicine. Welcome to the broadcast. What is mold and why does it have the effects it has on some people but not others?
Well, what's interesting is that a lot of chronic fatigue may be due to toxic mold exposure. And that was proven by a researcher who was an infectious disease expert, and he did a study that showed that over 90% of the patients with chronic fatigue had mold toxins in their urine. And this was done at a laboratory that measures the toxins. And now we know it's not just a sensitivity to the mold, but it's really the etiology of their chronic fatigue may not be viral. It may be from living in a moldy building.
Do you think well, often the onset is associated with exercise, not with mold? And as you probably know, it's a disease where most people can tell you when they first got sick, even to the first day of their sickness. And frequently, but not always, in my experience, having talked to many patients, is that it had some relationship to exercise, but not always. And of course, one of the ways of knowing whether you have it is to exercise and see if you collapse. This is pretty indicative that you are indeed, alas, afflicted with ME.
Well, I would say that when people are mold exposed or exposed to a high dose of a chemical that makes them environmentally ill, they can get two things: adrenal insufficiency, and they can get autonomic nervous system damage. And then they can become sensitive to chemicals and foods. So it's, I guess, three things. When you have this autonomic nervous system problem, your heart rate is fast when you're standing up. Things that make autonomic nervous system damage worse, or we call it postural tachycardia, or POTS, worse, are exercise, hot weather, standing up, having a large meal, going into a store and breathing in lots of VOCs or chemicals. And the last interesting thing is low barometric pressure when the rain is coming. And that is actually fascinating. Why I think cows lay down before it rains. So dysautonomia is the potential mechanism of some of the intolerance to exercise, because it makes it worse, and it's treated with medications and hormones and salt and stockings, and you can feel better within a day or two if you treat the dysautonomia. It's very common in the literature in chronic fatigue patients.
But I've not experienced patients saying that they had any quick relief from anything. Many try very different things, and they're ill for years, often for the rest of their lives, so that they experiment as much as their resources will allow them, both their resources financial and resources informational.
Right.
What is mold?
Well, you asked one question is why don't they get well? Let me answer that one first. I think it's really important to understand the difference between environmental medicine and other forms of medical practice. I was trained by Dr. William Ray in Dallas at the Environmental Health Center of Dallas, and I was treated there. And then I went and studied there. And he was trained by Dr. Randolph, who's the father of environmental medicine. It is imperative to see the patient every day. You can't treat a patient once every few months and get well. You can't give them a prescription and say goodbye and see them in a few weeks. It doesn't work. You give them a treatment, you see them the next day. Let's say the first treatment is intravenous vitamin C, and you do intravenous vitamin C and other vitamins for 3 days. Then if they have a dysautonomia, you give them midodrine and Florinef. If they have adrenal insufficiency, you give them Cortef. Those things, if they are medically indicated, dramatically improve the patient within the first 5 days. And that's what I lecture about. How do you take a patient in the first 5 or 10 days, get them between 20 and 70% better, and then the next 2 years, they have to get the rest of the way better. And it may require allergy testing, which we call provocation and neutralization, and it may require sauna, oxygen therapy, and hormone therapy. So it is really quite easy to do, and this is why I'm trying to
But there's
lecture about
a
it.
large number of things you mentioned
Yeah.
here, which is a lot of management, a lot of health management, care management, and most people have very brief periods with their doctors. They don't have days and days and days, and if they did, the expense would probably be crushing. How do you handle that at your clinic here?
Well,
and what is the name, by the way, of your clinic?
It's Environmental Health Center of Martha's Vineyard. And it is really the crux of the issue, is that you've got to see the patient intensively for a week or two, sometimes a month or two, and they can sometimes get covered by insurance. I take Medicaid and Medicare. I do charge for the therapies that are not covered by insurance, and that can run like $1,000 a week or $4,000 a week if they're doing lots and lots of things that are expensive. But basically, for a couple $1,000s a week, or maybe let's say $10,000 for an entire month or 6 weeks, they can live here, get treated, get better, and that's a lot more economical than being sick for a decade or two.
This is a residential facility.
I have housing a little bit on the island, some units for patients to stay, and as I have more business, I will expand and maybe be able to build more units for people to stay. But I don't see more than 6 patients a day usually. I spend lots of time talking to the patients in a group, explaining the theory and going over. They don't have a good memory. So it's important to be able to answer questions, and they write notes, and then they can refer to their notes if they don't remember the answer to the question. It's really not that hard to train doctors to do this kind of medicine. They need to be motivated, they need to be compensated for their time. So if a doctor makes a certain amount of money a day, they want to make that same amount of money, whether they're seeing 30 patients or 6 patients.
Let's go back to the duplicated question. What is mold?
So mold is basically ubiquitous. It's in decaying foliage. If you have leaves on the ground and soil, it's everywhere. But unfortunately, when people have toxigenic indoor mold growing in their drywall, it's usually Stachybotrys if it's black, or Aspergillus niger, or some other mold that makes toxins that fill the air, or VOCs, volatile organic compounds, that are chemicals like benzene and 1,3-butadiene or octadiene. And these chemicals overload the person if they're sleeping in a house that has a water leak in the roof, or a water leak that occurred in the basement and their drywall is wet. And sometimes the patient is so sensitive to the molds produced in that house, no matter how much remediation is done, the patient will never do well in that house again. So they can gut it, take away all the drywall, try to scrub the walls, but that patient will have to move on because their immune system is so sensitive now to the smell and the odors of those chemicals that are in everything. And somebody else may be able to move in and do okay, but basically they need to leave their clothing, their car, and their possessions if it's proven scientifically the toxins are in their urine and in their clothes. And that's how you get well. When you get out of your clothes after 4 days, they will then unmask and become sensitive to the molds and the chemicals in their clothes that previously they tolerated as they de-adapt. And then they'll be sensitive to chemicals in the environment. It's fascinating to watch.
What would you say to patients, chronic fatigue syndrome, myalgic encephalomyelitis, whatever title you like to give it, what would you say to patients who don't have a lot of financial resources, cannot afford very much, but are concerned with mold? And how do you test for mold, and how do you find out whether the mold, as you say, it's everywhere? I'm always reminded that it's in blue cheese. I like blue cheese very much. How do you test for it if you don't have a lot of resources, and how do you remediate if you don't have a lot of resources? The patients that have ME are patients that cannot afford to move house, to get huge testing. Some of them are totally destitute, living on welfare.
So there's a company called Real Time Labs, and you need a doctor to order your urine test. It is now covered by some insurances, and it is a great screening test for 4 mold toxins. And I did a study that showed if you do a little sauna before the urine is obtained, that the mold toxins come out about 10 times higher. So if you're going to do the test once and you had to pay for it, you would do it maybe after sauna. And the idea is if you have the toxigenic molds, the trichosithians are the worst toxin, and it's written about by the Army. So it's an agent of bioterrorism. It is not to be played with. It burns the skin off of soldiers. It's a couple hundred times stronger than mustard gas. This is not within the knowledge base of your average physician. So if you say that you have a bioterrorism agent in your urine or in your house, the physician will likely think you're mad or insane when actually the patient is quite smart to figure it out. You can also use a laboratory called Alletest, and they do IgG and IgE testing for molds and foods. For $90, you can find out if you have antibodies to molds because you've been living in a moldy environment. And they named the panel after me. I don't have any financial relationship with any of these companies. But if you screen and you find out you've got all of these molds like Stachybotrys or Chaetomium or Trichoderma or Aspergillus, then it's a slam dunk. You know somewhere you've been exposed.
Assuming that I were an ME patient living on very modest means with an apartment, maybe an efficiency apartment, and I see mold on the bathroom curtain, which is fairly common, the shower curtain. How do I get my home tested? And having tested it, how do I remediate it without enormous expense and bringing in a corporation and workmen and all that?
Well, the thing is, if the mold is on the shower curtain, it could be nothing. You just clean it off. If the mold count is high in the whole apartment, it will grow where there's water. Toothbrush holder, soap dish, shower curtain. So it may be that you have a mold problem in the entire apartment, but it's only growing in your bathroom. So you have to look in the walls. Now, what we do is we create an Oasis bedroom. So remediation is one aspect, but usually people just leave if they think the place smells musty when they walk in, not just the shower curtain, but that the whole place is making them feel symptoms like fast heartbeat or anxiety or depression. Then they create this Oasis bedroom in a hotel with a charcoal air filter, Mountain Valley glass bottled water delivered in 5 gallons, and they eat organic food on a 4-day rotation. Then they feel better, and then they can try to go back to the apartment and see if it makes them feel sick. If it does, some people will pitch a tent and live outside if they can't tolerate indoor environments. Even the Katrina.
Hard to do in New York City.
Well, they may have to leave New York because it's so polluted. Once you're chemically sensitive, living in a city is no longer much of a choice. You may have to move to a clean air environment, like I moved to Martha's Vineyard because I couldn't tolerate Los Angeles anymore and the ozone. My heart rate was 140, and I moved here and it was down to 90.
Now, you have suffered from mold and other substances in the air and food, etc. But you weren't diagnosed with chronic fatigue syndrome as such, were you?
I was kind of told that I had chronic fatigue by a person in Los Angeles, but my disease progressed very quickly. I had muscle weakness. I couldn't chew or smile or fold a towel. It was really hard for me to do any exertion. I would ride a horse and post for about 5 seconds and then rest. And it turned out that I would get home and I would lie down for a day or two after horseback riding. It was so exhausting. So what my diagnosis was that I had mitochondrial myopathy. And on biopsy, I had no oxygen getting to this part of the cell that makes energy, the mitochondria. So this is one of the reasons that people find fatigue. And I was lucky to get a very sophisticated workup because I'm a physician and not everybody's going to be able to save themselves. Not everybody has medical training to know when they're dying, how to figure it out before they succumb. So the fact that I had this Lou Gehrig's type picture, and my husband may have had a Parkinson's type picture and an autoimmune disease called pemphigus that burned off his skin, I am the luckiest person in the world to have figured it out, gotten better, and now I'm able to work again after being on disability for about a decade.
I want to finish this interview by asking you, if somebody is, for example, living in an apartment in New York City and doesn't know whether there's mold, what is the first step to finding out whether the apartment is contaminated?
Well, they do a mold plate, which is about $50 to $100. I use P&K microbiology, and you may have to get somebody, a mold person, to send the plates in or to do an air sample, but you want a culture. You want to know the genus and the species of the mold. If you see the mold, you can swap it and send, even Home Depot has testing that may be adequate. So I find that if you test the home, even for $100 or $200, you compare it usually to outdoor molds. Anything growing inside in a high amount that's not outside is going to be growing in your apartment. And it should be higher outside and lower inside, and that's a clue that you've got a mold problem.
And mold is an organism, isn't it? A growing thing.
It's not a bacteria, it's separate, it's got a separate structure, and it basically produces toxins to fight the other molds for territory. That's why penicillin was discovered, because it produced an antibiotic that killed bacteria on a mold plate, on a plate growing bacteria. It was just a fluke that I think it was Fleming who discovered it, but it was just by happenstance. So when we discover things in environmental medicine, the utility is we should take these discoveries and then lead NIH and NIEHS and medical doctors to do research on why we become damaged with the autonomic nervous system from mold exposure. It's a fascinating sequence of events, but I think everybody's worried about one disease, and we should be looking at the theory that encompasses all chronic disease so that all people can get well, no matter what the etiology, if it's pesticides, mold, genetic issues, hormone issues, and what disease they have, and not separate each issue and get funding for separate issues.
How do people get in touch with you? Do you have a website?
Yes, I do. It's www.lisanagyi.com. That's LISANAGY.com.
And your telephone number?
It's 508-693-1300.
And you will speak to patients directly yourself?
Yes, I can't practice medicine over the phone if I haven't seen them, and I do advise them going to YouTube under NIEHS and then NAGY, and they can find government lectures I've given, office videos for free help. They don't have to call me first.
Lisa, more power to you, and thank you so much.
Thanks very much.